Atrophic rhinitis management. Introduction. Atrophic rhinitis is a chronic inflammation of nose characterized by atrophy of nasal mucosa and the turbinate bones. The nasal cavities are roomy and full of foul-smelling crusts. Investigations. X-ray of paranasal sinuses appear opaque. Atrophy of turbinates can be seen. X-ray. Medical management. Complete cure of the disease is not yet possible. Treatment aims at maintaining nasal hygiene and removal of crusts and the associated putrefying smell, and further check crust formation. Nasal irrigation and removal of crusts is the mainstay of treatment. Warm normal saline or alkaline solution made by dissolving a teaspoonful of powder containing soda bicarbonate 1 part, sodium biborate 1 part, sodium chloride 2 parts into 80 ml of water is used to irrigate the nasal cavities. The solution is run through one nostril and comes out from the other. It loosens the crust and removes the thick tenacious discharge. Care should be taken to avoid pushing the fluid into the sinus and distribution tube. Initially, this is done 2 to 3 times a day. Later, once every 2 to 3 days is sufficient. Hard crust may be difficult to remove by irrigation. They are first loosened and then mechanically removed by forceps or suction. Another method is 25% glucose in glycerin. After crust removed, nose is painted with 25% glucose glycerin. This inhibits growth of putrefying organism, which is responsible for mild smell. Antibiotics can also be used to eliminate secondary infections. 7 to 10 day course of systemic antibiotics like fluoroquinolones with metronidazole can be given. Long-term antibiotics are not recommended. Estradiol nasal spray and submucal injection placental extraction have been tried but not found useful. Mucolytics 8 to 10 drops of concentrated solution of potassium iodide mixed with juice has been used to promote and liquefy nasal secretion. Diet. The patient should receive a balanced diet with particular attention to vitamin A, vitamin D, folic acid, iron and proteins. Surgical management. Young's operation. Both the nostrils are closed completely just within the nasal vestibule by raising flaps. They are opened after 6 months or later. In these cases, mucosa may revert to normal and crusting is reduced. Modified Young's operation. To avoid the discomfort of bilateral nasal obstruction, modified Young's operation aims to partially close the nostrils. It is also claimed to give the same benefit as Young's. Narrowing the nasal cavities can also be done. Nasal chambers are wide in atrophic rhinitis and air currents dry up the secretion, due to which the crusting occurs. Narrowing the size of nasal airway helps to relieve this crusting. The techniques includes the following: the insertion of autologous fat, cartilage or bone under mucoperiosteum of the floor and lateral wall of the nose and mucoperichondrium of the septum. The submucal injections of allografts such as alloderma, symmetra have been also used. Section and medial displacement of lateral wall of nose can also be done. Thank you.